is Marketing 101 for holistic and mercury-free dentists and fluoride-free offices, which is going to be a little different than everything else that you've heard. Marketing. This is it. Why would someone want to come to your office? Did you ever stop and think about that? Did you ever stop and think about that at a staff meeting? Let's just ask the big question. Why would somebody want to be here? And what makes them want to come back? And why would they be willing to refer their friends? What's the thing that makes you special from someone else? To answer that question, you have less than a second. There's a phenomenal little book I've been recommending for the last couple years called Blink, Malcolm Gladwell. Studies done micro-slicing people's reaction. If you haven't read this book, it's wonderful. The Cardinal study was done taking college students on the first day of class and asking them to watch a video of their professor. The initial studies were done several minutes long. Watch this professor. Tell me at the end of the semester, will you have learned, will you have met the course objectives, and will you have enjoyed this professor? Lo and behold, they turned in their papers, forgot all about them. At the end of the year, they were asked the same question. Did you learn? Did you meet the course objectives? And did you enjoy your professor? Almost verbatim, 100%, what they saw from the few seconds of video, watching the professor teach, correlated to the end. They kept slicing this down, micro-slicing, until they got to 0.6 of a second. Showing the professor on screen, off. What do you think? Guess what? At the end, they had the same reaction. We talk about first impressions all the time. What's the impression that you make upon someone? You either like them, I don't know why, I just felt comfortable there. I don't know why, but gosh, something about her just drove me crazy. And yet, you know this is a knowledgeable person you're going to. This is a dentist. This is a healthcare provider. They've been through school. They've been licensed. What is it that makes your office different from someone else? 0.6 of a second. That's all you have. Can you make a good first impression on a second time? Not really. You have to really earn it by a second time. So let's start by talking about what are the things that you do subconsciously, unconsciously. Anybody ever go out with friends after work? Good, you have a life. This is important. Anybody ever go to a restaurant? Looks kind of empty. You're walking in, you're sitting there, and you're talking about people, and you're talking about your day at work. What do you talk about? Anybody ever come from this world? I can't believe he patched that MODBL on number 19 again. I had the patient all prepped. I'm a former hygienist, so I can say this. I had the patient all prepped. We were going to do a crown prep. Patient understood. You know what he did? He patched it again. He patched it last year. He's going to patch it next year. I mean, this guy keeps coming back. Now, the waitress is standing there, waiting to take your order, thinking, God, I don't want to go to that office because they don't know what they're doing. Think about it. Think about what you say. How often you talk about, oh my God, I'm glad I had a mask on. That person had really bad breath. We're running behind again. I got to work late again because we're running behind. So what do they hear? This figure, this dental looming large figure, and pain. Is that what you want them to think about when they think of your office? Because perception becomes reality. If you think it's going to be a bad experience, they don't want to walk in your door. Did you ever go shopping to what somebody said is a really cute little store, and you walk in and you smell cigarette smoke on someone's breath, and you turn around and you walk out? Might be a really cute store, but perception becomes reality. The person behind the counter is a smoker. I'm not going there. I don't care if they sell the greatest stuff in the world. So it's not about you. It's about the marketing that happens, whether or not you realize it's happening. Today's economy. I have been in dentistry 39 years. If you do the math, I was doing it myself. Let's see, 1970, this is 2009. Yep, 39 years. We've seen market up, market down. Raise your hand if you remember the Ayatollah Khomeini. Raise another hand if you remember savings and loan debacles and buyouts. I was in college. I was at Old Dominion in 74, 75. in the summer of '75, if I wanted to come home to Michigan from Virginia, I had to plan it on odd-numbered Fridays because gas was rationed back then. You could only buy gas on odd and even days if you were on national interstate system. Well, actually, through all the states. So in order to get back and forth, if it was a long weekend, I couldn't have Friday, Saturday, Sunday, Monday. I was not going to make it back on one tank full of gas. You know what? We survived all that. We even as recently as September 11th were in a major national crisis, and we survived all that. So stuff that's happening in the news, stuff that you read about in the paper, rates trigger race to buy, refinance. This is just yesterday. More companies cut or end 401k plans. Healthcare is less affected than anything else. There will always be upturns and downturns. There's always going to be stuff that you can't do anything about. Market anyway. Market even more in a slowing economy, because the number one thing that the average person does is pull, number one thing an average office does is pull the advertising dollars. Let's talk about what happens in a traditional relationship. Months or years. We're going to watch that tooth. You know, see on that little x-ray, see that little spot right there? We're just going to watch that. And based on mutual trust, the hygienist tells the patient, you know, did you ever consider whitening your teeth or getting lumineers or something? And the doctor says, oh, you know, we've only had this relationship with Mrs. Smith for about 2 years now. I don't want to approach it to her. We're talking $1,000 a tooth. Let's just wait a little bit longer. Usually a traditional relationship has what's in it for me with them. It's a nice little acronym. What's in it for me? What's in it for me as the doctor is I'm sympathetic to today's economy. You know, I've learned all this information. I've got all this great knowledge, but you might not be able to afford it right now, so I'm going to take it easier on you. And you drove a nicer car in, so maybe I'll mention it to you. It doesn't matter. I drive a Saturn. I'm happy with my Saturn. Could I drive a Cadillac? Yes. Do I really care if people judge me one way or the other? No. Will they? Yes. Does it matter? No. Because when I come in for dental care or health care, I want it based on my needs. Your patient wants it based on their needs. If you're going to watch that tooth, well, that might be really nice for you, and you'd think that your office is doing a great thing just watching that incipient decay, and you're going to watch it get larger until it needs something more to be done, instead of doing the conservative thing and going, oh, Mrs. Smith, this is so cool you came in today. See how tiny this is? This is going to take no time at all to fix, and it's going to be at minimal cost to you. You just saved yourself thousands of dollars down the road by not needing an endo, by not needing a crown. Take care of it, no problem. Now, instead of saying, oh, Mrs. Smith, you should have been flossing, you know, you got a DO in number 29, the other approach is still marketing. Didn't cost you a dime, but it built a patient relationship. Strategic marketing is having a goal in mind. A captain sets out with his little sailboat, and if you don't know where you're going, you're just going to float around in the bay. You might end up going out to sea. No idea, no plan, you have no way to get back. If you have a goal in mind, you're going to elicit an emotional response. All marketing is getting an emotional response. Think about the car commercials on TV. Wow, it's sexy, it's wonderful, you're going to feel great. When you turn on the car, does it return the favor? Ever see a car commercial that says, once you buy this, you have to put gas in it? Every so many miles. Once you buy this, you better check the tire pressure every so many weeks. Once you buy this, every 3,000 or 5,000 miles, you better take it in and get your oil checked and your air filter too. Why do we change our lives in dentistry and say, now once we do this, you have to do that? Take it one step at a time. So first you need the vision. You want a bigger practice. You want a busier schedule. You want more time off. You decide. If you have it as an office have not done that, perfect topic for staff meeting. 1, why do people want to come here? 2, what do we want in our lives? It's called putting the big rocks in first. Advertising, marketing, and promotion. That's it. That's all it is. So it's not who or what you are, it's who or what you appear to be. You find your niche. Your frequency matters. You can't say you're going to advertise once. I'm going to take these, the middle point first. Right now I'm doing TV marketing. You can't have an ad on TV or radio once. How often do you get a postcard in the mail to come to the dentist? Once every 6 months. If you happen to hit somebody watching this who says, oh, that's a cool office, it's gone out of their mind as soon as the next commercial comes on. They get their postcard from their dentist the very next day, they might remember you. They get their postcard from their dentist 3 months later. Yeah, I saw that ad on TV. I don't know who that is. So you need frequency. If you use different media sources, you are now doubling your effort. You are actually 10 times maximizing your effort with each type of common ad that you do in a different source. We'll get to more of that in just a moment. Whenever somebody says, so what kind of office are you at? Like do you take kids, do you take adults? If you answer, I am the office for everybody, you're Sears and you're JCPenney's. You are here because you're Nordstrom's. You are here because your doctor has expertise that very few have and has technology that very few have. And your doctor is continuing to acquire knowledge. You're not for everybody. And you can't be everything for everybody. So you choose your target market and market to them according to your vision. TV advertising right now is the cheapest thing going. If you had told me 10 years ago I would have a TV ad, I'd go, I don't think so. Guess what? People pull ad dollars. You can get in small niche marketing with all the cable channels that are on. Choose what you normally work. It's a great topic for a staff meeting. What channel does everybody watch? And when you get home, do people watch TV? What do they watch? Well, if your commonality among your age brackets in your own staff are watching Fox News, start asking your patients, do you guys watch Fox News at night? And just kind of keep a little mental running thing. If they're all watching Nightline, do you guys watch Nightline? Watching CNN, watching the local cable channel. Start just talking to your patients over about a month's period and tell them, listen, we like people like you. That's why I'm glad to see you when you come in. We'd like to see more people like you, like-minded. So we're trying to figure out what you enjoy doing, and that's who we're going to be marketing towards. 6-month run is for the ROI is return on investment. Anything you do with marketing, you have to figure cost X amount should bring in X amount. Negative ROI is I spent $1,000, I got absolutely nothing. You lost money. So, who is your target audience? Almost all of us fall into this entire category. We don't just do seniors. Unless there's a pedo office here, you don't just do kids. You do everybody else. Demographically, we all have what works for us. Seniors are brought up on print. They read the newspaper. They're disappointed as can be that a lot of newspapers are falling by the wayside. They go to the yellow pages. But what do most people do? If you needed a plumber right now, would you go to the yellow pages or would you Google it? Call a neighbor. You're going to Google and you're going to call a neighbor. Because we are all of an age that we've learned how to Google and Yahoo search. Two biggest search engines, Google and Yahoo. The Gen Xers, by the way, the boomers, we still use some print, but we use some internet. The Gen Xers and the Gen Ys, I just pulled these up. This is the latest statistics on them. This is from Technology Benchmark Survey. It's Forrester's, which is kind of my source for a lot of this. Gen Ys are the 18 to 28-year-olds. 90% of them own a computer. They actually expect that to be higher, but we're using U.S. demographics. 82% a mobile phone, 72 of which users send and receive SMS messages. They spend more time online than watching TV. First generation ever to do that, 18 to 28. The Gen Xers, and by the way, the Gen Ys are also called the millennials because they're the first generation raised on technology. First generation ever to have multiple TVs in their home and have cable TV, just as a norm. The Gen Xers are the generation aged 29 to 42. They have lifestyle need to use the internet. A lot of your dentists fall in this category. They were not going to use technology. That girl at the desk knows how to use the computer. They're coming along because they've had to. They're learning to make the lifestyle change. During the past 3 months, 69% of Gen Xers have shopped online and 65% use online banking, more than any other group. So although they're coming along, they're really advancing over the Gen Ys because suddenly they found something that makes their life easier. 61% are mobile subscribers as compared to 49% in 2007. That's a huge increase. They're learning to text. This is our generation. This is cool. They love gadgets. Ask them when you confirm their appointments, would you like me to make a phone call? Would you like me to text? A lot of dental software is now catching up with the capability to text the confirmation. Never on the first new patient visit, but for everything else. These millennials, the Gen Ys and youngers, by the way, aren't going to be swayed by convention or tradition. They are predicted to be the next greatest generation. They don't believe anything you tell them until they Google it or Yahoo it. Think about that. My parents' generation, the older seniors in their 90s, the doctor said so. It must be true. So the art of getting your referrals in is asking. It's energy, enthusiasm, and empathy. By the way, difference between empathy and sympathy? Sympathy costs you money. Empathy earns trust and builds you money. Sympathy says, oh my gosh, Kristen, I'm so sorry that your husband lost his job. Let me ask Doc if we can take something off that bill today. Or maybe we won't do the x-rays today. Doctor, I'm so sorry, but Kristen's husband lost his job and I just don't know what to do, but we're going to try and help her out today. Empathy said, Kristen, I'm so glad that you care that much about your health. Let's take care of whatever we can while it's smaller, while it's cheaper for you. Big difference. The semantics I use towards her makes her feel, that's right, I did the right thing. So when she goes home and her husband says, how much was the bill? You know what, but we're going to take care of whatever it is smaller. And these two, oh boy. Anybody ever ask your friends, do you have a dentist? Turns most people's stomach. I'm an optimist. I am. I belong to Optimist International. We have a little button that we wear called Just Ask. And now I'm thinking, I'm going to get more of these. I'm going to wear them in the office. You can make stickers that say, just ask. Go ahead, ask me. What does the button mean? Because usually that's what people do when you're at an Optimist convention, you're staying in the hotel, you're riding down the elevator, and they go, just ask what? In our world, it's, do you have a biological dentist? Do I have a what? I have a dentist. Do you have a biological dentist? I don't know what that is. Just opened up your 2 minutes of opportunity to talk because you have elicited a response from them. They want to know. If you ever meet somebody at a convention or even going out to dinner and you meet another couple, what do you do? I work for dentists. Okay, what do you do? But biological dentist is something very different. Gives you that opening, and now you have an interested party who wants more information. Marketing through time. Again, the biological just ask. Marketing has always been a word of mouth until the 20s and 30s. Think about it. What happened during the Depression? 80% of the population was still employed. They say the Depression was not so bad. I'm reading a great book called The Forgotten Man. Depression wasn't so bad for those who had a job. You know why healthcare had no problem? Because people needed healthcare. Newspapers and radio provide a means to disseminate that information. I am your healthcare provider, and I'm local. Oh, do you remember the peacock on Channel 4? Living color! The first few commercials on the only 3 or 4 TV stations that you had, you paid attention to anything that came out in living color. It was so cool. Now we have the internet. Oh, that's right, those newspapers just fell away. San Francisco, Boston, Detroit, many others are going to stop publishing daily papers. If you're advertising in a print media, if you're advertising in a newspaper, anything other than your local paper, people will read your local paper. It's filled with human interest stories. It's filled with things going on right here, right now. But if you're advertising in a big community paper, you're going to lose advertising dollars. It's like the lamplighters. We don't need them anymore. You can get it online and you can get it right now. News was supposed to be new. It's not new if you're reading something that happened 4 days ago. And again, the Gen Xers and Gen Ys, no, I can just go to the internet and get updated, real-time, this happened 33 minutes ago information. Radio keeps that going. What do most of us do? We have sound in the background. Even if you're listening to your iPhone, or I have my iPod on my iPhone, you're listening to your music, where did you get it? You downloaded it off of something. Somewhere along the way, you're listening to new stuff. That's good. So you need to set a marketing budget, because as much as word of mouth is still there, how do you know what to spend? Standard, industry standard for medical dental is still 2%. If your office, mine is grossing 1.2, that means $24,000 a year or $2,000 a month. Whatever your office is doing, you're probably marketing and you don't know it. Your Yellow Pages ad is marketing. If you're spending $300 a month in Yellow Page ads, beautiful display ads, you know who that's helping? The Yellow Page sales representative. Again, if you're going, suppose, ladies, you need a new gynecologist. You're going to go to the Yellow Pages? I don't think so. I'm going to ask a friend. I'm going to Google them out. I'm looking for bioidentical hormone replacement. I'm Googling it out. I'm seeing how many people like that. I'm looking at different blog sites on it. What do people say? So you need to budget appropriately. For real, you do not need to spend advertising dollars to put your name in a Yellow Page unless you're getting a substantial return on investment, which you're probably not. Every phone directory will list your business name and number. If you want to spend about an extra $10 or $15 a month, add one more line with your website. You need your address much less. I can say Ortonville or my website. Nobody knows where 101 South Street is, but once they like my website, they're going to find a way to come up to my office. If you're marketing on a shoestring, which a lot of us start out that way, you need to offer something. Now, this is the traditionalist. Whitenings, exams, x-rays for free. Boy, this is the sticky wicket. If you take insurance, if you participate in any type of dental insurance, oftentimes patients don't tell you until afterwards. If I get the free exam here, I'm not going to use my insurance benefit. It gets very dicey, very ugly. So instead of the freebie thing, you can do some other type of marketing like a Val Pack or one of those which have a surprisingly good return on investment, even though I personally have a problem with that. Because somehow you're putting it into print, and while they may save those type of shoppers are still going to want some type of a coupon for value. And you have to lock in you need to lock in for at least 3 months some type of a rate, because a one-time ad will not bring you a return on investment. But the best ideas are still electronic, including banner ads, websites, and sophistication. Need a good web address. You need something that's either your name, which is awfully good to have, or something that is going to get someone to be able to remember to repeat it to someone else. We're Regiani Dental. Our name, Dental. That's all they need to know. Clear search words. You can buy search words. Holistic, mercury-free, fluoride-free. Those are the big ones. If you are connected with the Academy, and I think most of your dentists are, you can be linked to the Academy website and use theirs. Make something easy to navigate, because if you have the most beautiful website, but somebody's looking for your name and or your address or a phone number and they can't find it, that's not going to help you. Use actual photos. You can buy stock photos of anybody. And guess what? Dr. Smith has the same photo of the smiling face that you have on yours. Use actual photos. Ask your patients. You have a great smile, Mary. I would love to put you on our website. What do you think? You think Mary's going to say no? If you call up Mrs. Smith and say, you have a 14-year-old son who has just gone through Invisalign and looks terrific, do you think you would let us, would you let us use a before and after photo of him on our website? If you have staff that have had procedures done, ask them, can we put you on our website? We've just done some tooth whitening or some tooth lengthening. Use multiple pages. You need one for just contact information and frequently asked questions and a place for them to email back to you. Map and directions, links to references, and if your doctor blogs. I've just been taking a whole series of seminars on blogging. Believe it or not, they have seminars on how to blog. If you're not familiar, you're laughing because you do this all the time. Or if you've ever heard the word twittering, it's just a very short little message. Now, twittering is on a cell phone, somebody asks a question and you answer it. Or you follow what other people are answering. And the basic question on Twitter is, what are you doing right now? I don't advise that for your blog, but you could just write out a question. Anybody ever, or do your gums bleed? And then people can answer it right there. And then you can say that if your gums bleed, are you taking vitamin C? How much vitamin C are you taking a day? You can start gearing your patients thinking about you and coming to you as a reference. Why is vitamin C important if your gums bleed? Are you continually breaking a filling on one side of your mouth? Bite imbalance. Let people that are not your patients answer and post questions into your blog. Post answers there. You can respond back. If you have one person in your office who can just check this for 1/2 hour every day and respond back, you've got a dialogue going. And for the Gen Xers and Gen Ys, that's what you want. Make sure you advertise your website everywhere. Your business card, your stationery, your pens, your promo items. Promo items. Lip gloss with the cute little people on them. Have our website. Pens, have our website. Smiles to go. If you have Patterson Dental as one of your vendors, Smiles to go is a really neat little thing, credit card size. It's floss and a handy dandy little mirror, which, by the way, you can have your name and website emblazoned on and phone number. This is a brand new one, so I'm not going to break a nail on it, but it does slide up. Magnets, little baggies that come out of your office. These are great. Make them large enough so that people will reuse them. One point in time we thought we could use smaller bags. You know what? They throw those away. You want that reused. If you sponsor any events or contests, or if you're in a small town like we are Ortonville, and you're sponsoring, say, a kids' t-ball team, our logo, our phone number, or web address. Let your friends know what you do. What do you think, Debbie? Finally managed to create chocolate-flavored floss. Could be a market. Social networking. Anybody here on Facebook? A couple. Okay. Do you ever show good pictures of you at work? Or did you ever write down some really ugly things about the long day we had today? Oh my. Just think. It's your Facebook, it's your MySpace, or your Twittering. LinkedIn, by the way, as professionals, is more for business professionals, as is GiveLink. But if you're marketing this way, what's the message that you're sending out? Because you always are marketing. So make sure if you're showing pictures at work or you're talking about your day at work, it's in the positive. Because everybody who's going through your website is seeing it. Flickr and YouTube. I don't Flickr. I am learning YouTube. You can buy for $149 the coolest little video cam now, about the size of an iPhone, USB attachment, plug it in, download automatically to YouTube. You can do YouTubes of your own office, embed the link into your website. which means I'm going to show how nice it is to whiten Debbie's teeth. We're going to have Debbie sitting there smiling. Lumen Shade Guide, this is what she looks like. Whiten her teeth. New Lumen Shade Guide, that's what it is. And you can show time lapse, this time to that time. And in about 15, 20 seconds, this is how whitening works. And Debbie's smiling afterwards. I can take, we do LANAP. We do laser-assisted perio treatment. We can show how, you get the patient's permission first, they're going to sign a release, how easy it was to just remove the calculus without surgery, and how afterwards the tissue looks, and you're going to be smiling at the end. A picture is not worth 1,000 words anymore. A picture is worth 1,000,000 words. Ask your own patients. You put those little YouTubes right there on your website. Oh, and guess what? It's YouTube. Somebody looking for whitening might just stumble upon you in YouTube. Thinking about this, I was at a leadership conference a week or so back, and the presenter was talking about his need to have a root canal. And he said, I've never had one, didn't know about it. I Googled root canals. And okay, there's some information. And then there was a YouTube. So he went to that. He learned more about the dentist, learned more about the procedure. The dentist had an e-book, which I'll tell you about that in just a minute. And he said, if this guy had been in the same state as, he lives in Michigan, he said, I would have gone to him. He was halfway across the country. He said, but I just learned so much, and the dentist looked so nice and so normal talking about it. He said, because I always thought people doing root canals were, different. But there you are. There's your office. Your office is in the background. It's clean and sanitary, looks inviting, looks friendly. Your patient is not writhing in pain. All the subliminal marketing, how much did that cost you? Oh, let's see, for $149 you download it and you got your little video camera back to use again. You can even get testimonials. What did you think of this seminar, Kristen? What did you think of this seminar? And I can't see your first name.
Barb.
Sorry. Barb. What did you think of this seminar, Barb? Barb, what did you think of your first visit at Dr. Regiani's office today? Ask people. People actually love doing this, because I've been putzing with mine. And you stick it in your website. And then when somebody needing an endo or looking for a dentist Googles it or Yahoo searches it, you're going to be one of those people to pop up there. Another thing that I learned, instead of buying search words, this is my brand new thing, AT&T owns the biggest network of search engines. So instead of having to buy search words individually and pay $60, $70, $80 a month, you could actually buy a web ad with them that will include everything that you want. So rather than spending money on a Yellow Pages ad, which again is who's that going to attract? An older population, which if you're looking for an older population primarily, that's good. If you're looking for across-the-board population and a more health-conscious population, which, again, the Gen Xers and Gen Ys, because they have rapid information, that's where they're looking, you can use these search words. So then just call up whoever your AT&T person is and say, listen, I'm not interested in print ad anymore, but tell me about what we can do for electronics. All right, so you have attracted somebody to your office. They found you via YouTube. They found you via the internet. They found you via the IAOMT. So there are 3 things that every patient decides. 1, I'm going to give that office a call. So they had a good experience on the phone. Somebody sounded empathetic, not sympathetic, but knowledgeable on the phone. So 2, they made the appointment. That obviously went well, because guess what? 3, they walked in the door. You know the old saying, 3 strikes you're out? Well, 3 strikes you're in. Now, don't mess it up. Offices do that. Hello, you open the little window. Here, fill this out. Go have a seat. Wow, that wasn't what I expected. Don't mess it up. Follow it through. Hi, Mrs. Smith. Nice to see you. Or, hi, you must be Mrs. Smith. Nice to see you. We've been expecting you today. Did you bring your health forms with you? Because, of course, you're going to mail these out ahead of time. They can tell them they can fill them out in the privacy of their home. Great, let me just take a look at this. We've got everything all signed here. Terrific. Let me go tell doctor that you're here, and you can have a seat. If they're here early enough and you have a refreshment station, you can tell them they're welcome to help themselves to a beverage. You can have Casey going on in the background, or TV or something, or a fish tank, just something that makes you look less sterile. Anybody remember laughing? We're the phone company. We don't care. We don't have to. The person answering your phone is your number one direct marketing person. There are offices who still think I will have my top assistant, the other two that scrub instruments, and my girl at the desk. When people ask me about my girl is 23 years old. She works for Royal Caribbean. You mean my professional business assistants? Yeah. Kristen's here. I don't have a girl at the desk. Please don't use that term. Don't ever use hun to people either. That's very downgrading. It's a professional office. Professionally. And things that we think are funny, patients don't think are so funny. Yeah, I got to think about that one, huh? How is the phone answered in your office? It's a great day at Dr. Regiani's office. Thank you for calling Dr. Regiani's office. This is Sherry. How can I help you? I'm not going to ask him to hold until I've gotten at least a couple sentences out. And if your phone is ringing off the hook so much that you're the only person there that you have to answer it, Dr. Regiani's office, please hold. Dr. Regiani's office, please hold. Dr. Regiani's. They either, one of two things are happening. One, you have a great marketing campaign. Two, you're understaffed. If you can't answer the phone in 3 rings, then you need to sit down with your doctor. I was talking to a doctor earlier today who just really, he's got one full-time business person. And I said, well, what if she has to go to the bathroom? You know, think about it. You just might need somebody else up there. So now you need to convert those new patients into appointments. Again, it's enthusiasm and empathy. What to say and what not to say. Hi, I'm calling because I saw that you're a mercury-free office. My husband has MS, and I'm really looking for somebody to cure him. Ooh, what do you say now? Well, let me get some information from you first. Yes, we are a mercury-free office. First, let me get your name, your phone number. You should have a script that you follow. Do not let them control the conversation. They're coming to your world. You need to control the conversation. You need to get the basic information. Is your husband having any pain right now? Has he been referred by another healthcare provider or from a friend? You're going to want the referral source. The way we do things in our office is going to be totally different than 99% of the other dental offices. The first time your husband comes in, he's going to see Dr. Regiani and his assistant, and it's going to be an information gathering full examination. It will take 90 minutes. Oh, but I just need my teeth cleaned. Okay, but the first time you come into our office, this is the way we do it. Yes, but I just need my teeth cleaned. Well, here's the way it works. It's kind of like calling your mechanic and saying, my car makes this funny noise. Can you fix it today and how much it'll cost? Really? Until we see you, we can't evaluate that. You know, some people come to us and actually, even though they haven't had their teeth cleaned in a year, they really don't need it. They're taking phenomenal care at home. The majority are going to come in and need some type of basic cleaning, but there's another whole percentage that have gum disease and don't even know it. So we're not a one-size-fits-all. We treat you according to your needs. You're putting empathy there, and you're putting the words that they need. Insurance. Do you take my insurance? Anybody here a PPO office? Okay. You have to ask the questions that lead to the insurance that you take. The only PPO type that we do is Delta Premier in our office, which, by the way, if you are taking something like a Prudential or one of those where you're on a list, that also is marketing. A portion of those dollars that you lose are just consider them marketing dollars because your name is on a list. For most of the offices, you're going to ask them their insurance information, and you're going to tell them that we do everything in our power to maximize your insurance. That's all you need to tell them. Well, my other doctor said 20% of this and 30% of that, and I had to pay 50%. Well, first let's come on in and let's see what you need. First come on in and meet us, and we'll go over all the insurance information with you. The days of bring your insurance booklet are over. We have real-time information. You all should be online. You can look it up instantly. They'll fax it to you, or you get it online. But don't get off task. You want to treat them, not their insurance. So, use a checklist. Write down the most important questions. Sit down with your doctor with the most important questions that he wants answers before he sees someone in the door. First, most important, are you in pain? If you're in pain, you know what, we're going to get you in now. And by the way, when you do that, have time slots. Twice in 30 years, we have had a child hit in the mouth with a baseball bat. Both of those instances come in now. I don't care if you've got a CERAC patient booked for a half a day. You bring that child in now and you tell whoever else is there, we've had something very, very child hit in the mouth with a baseball bat. Anybody would want their child taken care of that same way. But for most people, emergencies are actually urgencies. It's really hurting, but what they don't tell you, it's really been hurting for the last 2 weeks, but I can't come on Tuesday, it's bowling day, and I can't come on Wednesday afternoons because my child has T-ball, and I can't come on Thursday because that's my busiest day at work, and I can't. Okay, it hurts bad enough you picked up the phone. We can see you at 9 o'clock, or we can see you at 2:30. That's it. Well, really, could you see me at 1 o'clock? No, I'm sorry, I'd have to put you on somebody else's lap, and that just really doesn't work. Give them choices that you want them to make. So you're going to follow a script, write it down. You're going to repeat the spelling of both their first and last name. People will usually do Regiani. It's R-E-G-I-A-N-I. Do you know how many times they ask me how to spell Sherry? I get S-H-A-R-I, S-H-E-R-I, S-H-E-R-R-I-E. I'm S-H-E-R-R-Y, thank you. Please ask. Ask for a daytime number and a mobile number. We used to say home and work. Ask them if they can take a call at work. But a daytime number, you ask me for a daytime number, you're getting my cell phone number, because otherwise you're just not going to get me. Snail mail your new patient packet. There's a lot of stuff you can do electronically, but snail mail it, because you can stuff in everything else. That while Mrs. Smith is the one coming in, her husband's flipping through going, oh, care credit. What's that? Oh, CERAC, 1-day crowns. Hey, you know, last time I had to go to the dentist, they put all that goopy stuff in my mouth, and I had to come back and get shots again, and I'd take another half day off work. 1-day crowns. It's pretty cool. Lynette, what is this periodontal thing? Laser. So you want that laying around their house. Oh, come on. There we go. Confirm a day or two before. Generally, you're going to confirm their appointments 2 days before. Now, we're a Monday through Thursday office. So on Thursday, we're going to confirm Monday's patients, but we're not going to confirm Tuesdays. It's just too far in advance. You're going to want 2 days, because what's going to happen? More than likely, you're going to get voicemail. It's rare nowadays to actually get a hold of someone. You get voicemail, you leave a message, they listen to them in the evening. Oh man, I've got that appointment at 8 o'clock in the morning, but I've got a presentation at work at 8:30. I can't make it. I'll just call and cancel it. Would you rather they call you, if the appointment's Wednesday, would you rather they call you Monday night so that you can call them back and go, oh my gosh, Mrs. Smith, this was for your crown prep. This was for the tooth that Doc is hoping does not need to go into anything larger, and we're going to try and preserve that tooth in your mouth. Oh, that's right. Give them a reason why. You've also got a day, if they're going out of town, there's going to be no way under the sun, you've got a day to fill that opening. And it's a reservation. This is a 90-minute appointment reserved exclusively for you. So remember to eat a good breakfast before you come. We look forward to meeting you. There's nothing here that says, and if you have any cancellations, call us back at 248-625 or 627-4934. I am not running a hair and nail salon. This is our profession. There is no normal of calling us to cancel us. If somebody told you you had an appointment, you think doctor, and you get like a little queasy, especially someone who hasn't been to a dentist for a while. But if you have a reservation, that's kind of like going out to dinner. I've got a reservation. Semantics. Now, They're walked in the door. So how do you represent your office? Blink. Again, 0.6 of a second. Blink again. They walked in the door. If you've got somebody with blue nail polish who's writing or scratching their name off on the little sign-in sheet, that's not professional, is it? You have somebody with heavy perfume. That's not professional. Blue eyeshadow. Vibrant blue eyeshadow. That I can tell it's blue eyeshadow. Really nice, but not professional. Best thing really is whole staff wear uniforms. OSHA approved. Looks nice. If you don't, still tasteful uniforms. If you are working up at the business desk, or any of your business assistants are here today, don't come dressed the way that I am. What's going to happen when Mr. Smith's on the phone and I go get his chart? Oh my. We're slacks at work. It's just more professional. So if you look like a professional, you dress for success, including your shoes. If you take the time to wear polished, nice shoes, and I'm not talking about go to Nordstrom and spend $200 on a pair of shoes. I'm talking about clean and polished shoes. In the nursing industry, we used to call those duty shoes. You're going to look more professional. Avoid the heavy makeup and perfume, appropriate language, and volume. Good story. My own physician's office. They're trying so hard to be HIPAA compliant. They've got the little tear-off strips, little sticky strips that they take your names off. And I'm sitting there in the office. Yeah, thank you. That's my 5-minute warning. I listened to the young woman on the phone. New patient. Yes, Mrs. Smith. All right, we take a $100 deposit before your first visit. Your Visa card, 4128-6123-65. Repeated it, got her CCV number off the back, repeated it, repeated her address. I'm as close as you are. What are they thinking? Turn away from the desk. If you have a very small desk and you need to take somebody's payment over the phone, turn away from your patients in the reception room. And never call anyone hon. Yeah. Hun is a term, you call me hun, and I'm going to say, no, my husband can call me that. It's a term of endearment. Thank you. And of course, you're unique like everyone else. So are your patients. They live in your same world, too. Appointment day, NLP. Body language. The fastest way to get somebody to be interested in what you're doing is to look interested in them. Well, Mrs. Smith, you're 5 minutes late. I'll see if doctor can see you. Boy, doesn't she feel great about walking through? Gosh, Mrs. Smith, I'm so sorry you're 5 minutes late. You okay? Did you get stuck in traffic? Was there an accident or something? Just want to make sure you're okay. All right, you sit down, have a breather. I'm just going to let doctor know that you're here. You know, and when you come back, doctor's still going to be able to see you. We're going to get you in right away. I'm sorry, but most of our patients come 5 minutes early, so that's why we were worried. We just want to make sure nothing happened to you. Now, I'm leaning in when I'm talking to her. That means I'm willing to have that conversation. You need to do the same. You need to mirror them. If you're having a consultation and they've crossed right leg over left, cross right leg over left. They don't know why, but blink. Something about it. They trusted you. They liked you. They felt good about you. Diagnosis and treatment planning. Oh, I've got 5 minutes left. We're going to take 7 minutes. Yes! Diagnosis can only be done with someone with a license after their name. Thank you. If you do not have DDS or DMD, you may not diagnose. I'm a former hygienist. I can diagnose periodontal disease. My little world. That was it. If you are not a DDS or a DMD, you may not tell somebody what they need unless the doctor says it first. Doctor diagnoses, you reiterate. Doctor diagnoses, you further explain. Doctor diagnoses and does treatment plan, and you set up appointments. You can show Casey, you can show a treatment plan presenter, but you do not diagnose. This is where offices get in trouble. There are 2 types of law. One is black law. It's contract law. You go buy a car, you're going to have 60 months of payments, they give you 3 pages and you're signing away. This is contract law. The other type is called implied consent. You work for a dentist. Therefore, you are his employee representing his or her interest, his or her office, his or her license. If you say, this is what needs to be done, if you say, mercury is a poison and you need to have it out, if you say, mercury leads to neurological disorders and your husband has MS, so you need to have your husband have those fillings out, we just also violated HIPAA. That's the husband sitting there and is deaf. If you're putting that out there, you are messing with the doctor's license. Because if the outcome is not 110% of what that patient envisioned, that patient later tells their friends who says, I called that lawyer on TV. I don't think that was right. Guess who's in hot water? Oh, that's right. You, the person who said it, the patient, have now gone on to another job. But you represented that office. You cannot say anything beyond what your doctor allows you to say. And in every state it's a little different, so I'm not going to go over the particulars. But staff reviews the treatment plan, reviews the fees, and schedules the next appointment. Never promise to cure anything or elaborate on the doctor's message. That's the doctor's territory. Doctor says periodontal disease, several repairable teeth, some with new decay, a couple missing ones to replace. It's going to take 6 visits over 4 months. Would you like me to go over it any more of it again? Anything in depth? Sometimes patients, the white coat thing, especially the 60-year-olds and up, are going to go, until he leaves. And whether it's an assistant or a business person sitting there, what did he say? Go ahead, reiterate. That's fine. Fees. Discuss them. They're going to find out anyway. When I started working at the business office, remember, I'm a wet-fingered person, so when I first started up at the front desk, the worst thing is they come up and they have no idea what it's going to cost. That's bad. Since they're going to find out anyway, it's nice to tell them up front. You're going to need 6 visits, 4 months, it's going to be X amount of money. But you don't have to itemize. My least favorite thing to hear is when someone says, well, tooth number 14 needs a crown, tooth number 15 needs a core and a crown. And they're looking down there, well, that's an extra $200. How about I just don't get the core? I'll just have the crown. They're not buying a car, it's not an option. The treatment should have been presented as if there is not enough bulk of a tooth to hold anything. But that's okay. We can build it up, we call it a core, and then we put the cap, the crown on top. The other tooth, fortunately, doesn't need that because you came in soon enough. Written treatment plan, define your payment expectations. We're going to divide that out, divide by 6. And then, is there anything in your schedule I should know before we set up your next appointment? There is nothing worse than the patient going, nope, I'm ready to go. You forgot to ask them anything in their appointment, in their life. Doc preps 3-4 teeth for crowns. We're doing quadrant dentistry. Patient's happy as a lark. Come up to the front desk. You want me back in 2 weeks? Oh, I'm going to Europe for the summer. Oh, we're in Michigan. I'm going to Florida for the winter. I won't be back for 3 months. That's a problem. Find out ahead of time. And that equals value. I'm going to go through these really fast. Want referrals? Just ask. Inform your new patients. It was nice to meet you today. I come on over 2 minutes. I'm going to send you home with some information, and this is something that we're going to do as a refer a patient program. A couple of referral cards, just write down referred by, and now you can offer them something. So you can give them movie passes. You know, we like people like you, so obviously you're going to have friends like you. Anytime you refer someone to our office, they bring in this little card, I'm going to send you a couple of movie tickets. Tickets at work is a great place to get those. Lottery tickets, some people do that. Personally, I don't, but you can lunch certificates to a local restaurant or gift cards for services in your own office. And you can make those up for free. You just make them up on the end of a piece of paper and print it out. Okay, that's going to be marketing for right now because they're cutting off my time.